One question, everyone. How many arches do we want to close?
All of them.
20 per month. That's my goal. We're doing about 20 arches a month. We want to get to, 40 to 50.
So we're hoping to get to 40 arches.
We doubled our practice last year. We're going to see if we can do that again this year.
I'm at this level, but I know there's some things I need to tweak to take it to the next level.
Our goal this year is for 500 plus. Next year I think we'll be on for 650 to 7.
That's my closer.
The Closing Institute has been life-changing for Dr. Connolly in the practice.
Right from the get-go, they're very open about, a sales process that's lacking in a lot of dental businesses.
It was so informative as far as the takeaway, learning how to apply it.
I like that we're listening to a lot of experienced speakers who are giving us their advice, their input on how they've made this successful.
It's all about creating relationships.
Every patient's different. Every case is different. How can I make it work for this individual?
What's different here is that it's like, okay, what's your office doing, We're sending you the leads. I'd say for someone that hasn't experienced good success with marketing, that this is maybe the missing piece for them.
This really isn't the place to come if you're just looking to close a few arches. The Closing Institute is where you come to close full arch implant cases in volume. I'm talking 20, 30 arches per month.
You got to build, you got to invest, you got to build into team members, and you got to let them fly.
Progressive values the team, the staff, and you can't do that traditional dental model.
You don't know who's going to close a case, right?
I did not come to the last Closing Institute with them, so they just brought back information to me. But being here and seeing it and hearing it myself is just a different situation.
It's a culture. You have to get the whole team involved so it can work like a nice machine.
They're the first contact with the patients. They're the ones that are going to be interacting with that patient, creating the first impression. We're here to learn all we can to maximize the patient experience when they come to our office.
You have to immerse yourself, obviously.
It's hearing it over and over, how to reinstitute it in a different way.
We are so excited, so much excited to learn new tips and tricks and tales and closing arches. Do you guys hear the music? I'm like, oh, it's so early, but you know what? You're walking to it, you're getting pumped. Here we go.
Oh my God, it was so engaging. There's not a second to be bored.
We like the energy that this is about. It pulls you in.
The stage just keeps getting bigger and better. You can hear the music thumping in the background. Not your typical dental event. It's doubled and doubled again and just keeps getting bigger and better.
Simply wow. I feel like I'm just going to go back a better clinician. I can't wait.
I need them to see the vision I'm trying to create.
When only one person is engaged and the rest of the team don't understand, it's very hard for everybody and move the practice to the next level.
The Closing Institute is really amazing at doing the one-on-one coaching and role playing.
Since we started Progressive, man, the sky's the limit. Sky's the limit.
Dr. Brand, in one word, what would you describe this event as?
Phenomenal.
Awesome.
It's amazing.
Enlightening.
We want to do full arches!
You have to run with the runners.
And that's a wrap.
Okay, ready?